When you think about managing diabetes, the conversation often turns to slashing carbohydrate intake, taking prescribed medications, and keeping a close eye on your blood glucose levels. While those factors are undeniably crucial, there's another element in the diabetes management puzzle that tends to fly under the radar: micronutrients. In other words, the essential vitamins and minerals that empower insulin to do its job, safeguard nerve health, and ward off severe complications. The reality is that many people with diabetes are chronically short on vital nutrients that directly influence blood sugar regulation, energy, and overall organ function. If you're lacking these key vitamins, you're inadvertently making your condition tougher to control than it should be. In today's video, we're going to explore the top 3 vitamins that every person with diabetes should consider. If you're battling constant fatigue, persistent aches, or unpredictable blood sugar swings, addressing these nutrient deficiencies might be the breakthrough you've been waiting for. I promise you, stick with me until the end, because I'll also reveal the best dietary sources and supplement options to ensure you're getting a steady stream of these life-changing nutrients each day. Let's get started. Vitamin D, the unsung hero. Let's kick things off with vitamin D. If you have diabetes, you might be surprised to learn just how integral this nutrient is, not just for healthy bones or immune support, but for a host of functions that include insulin sensitivity, controlling inflammation, maintaining nerve integrity, and even protecting vital organs. The irony is that individuals with diabetes are more likely to suffer from a deficiency in vitamin D. This vulnerability is partly due to insulin resistance and chronic inflammation, both of which can disrupt the body's normal processing of this vitamin. Additionally, elevated blood sugar levels and the resulting frequent urination lead to a faster depletion of vitamin D before your body has a chance to utilize it fully. Another factor at play is lifestyle. Many diabetics spend insufficient time outside, reducing natural sun exposure, which is the primary way our bodies synthesize vitamin D. This challenge only intensifies with age, as your pancreas and liver begin to falter in their efficiency to activate vitamin D. Even the sun's contribution might not translate into the benefits you need. While a simple blood test that measures 25-hydroxy vitamin D levels can confirm a deficiency, your body also signals when vitamin D levels drop too low. Persistent tiredness, muscle weakness, bone discomfort, delayed wound recovery, numbness, recurring infections, and mental cloudiness can all be red flags. Some individuals may also experience unusual sugar cravings, mood fluctuations, or unexplained inflammation, all potential signs that your vitamin D levels are suboptimal. When vitamin D dips below healthy levels, virtually every major system in your body is affected. For instance, fertility can take a hit. Men may experience lower testosterone and diminished sperm quality, while women could face disrupted ovulation and imbalanced estrogen levels, complicating conception. A drop in libido is common for both genders, partly because testosterone, a hormone significantly influenced by vitamin D, plays a vital role in energy and sexual desire. The nervous system is also compromised, since vitamin D is key for nerve regeneration and protection. Insufficient levels can worsen neuropathy, heighten sensations of tingling, and dampen reflex responses. The kidneys, too, are put under extra strain, as vitamin D is essential for regulating calcium balance. Without it, the risk for kidney stones and chronic kidney conditions rises. Additionally, eye health can decline. Low vitamin D contributes to retinal damage by fostering inflammation and oxidative stress in the retina's delicate blood vessels, gradually impairing vision. But the impact doesn't stop there. Cardiovascular health suffers as well, with low vitamin D directly linked to hypertension, arterial rigidity, and the buildup of arterial plaque, all of which elevate the risk of heart attacks and strokes. On a cellular level, think of vitamin D as a master regulator for insulin sensitivity. It binds to receptors in the pancreatic beta cells, enhancing insulin production and secretion, while simultaneously quelling chronic inflammation by lowering pro-inflammatory cytokines that are often elevated in diabetic conditions. Furthermore, vitamin D plays a critical role in managing calcium transport within cells, an essential process for nerve signaling, muscle contraction, and maintaining stable blood sugar levels. So, how can you naturally boost your vitamin D intake? It all comes down to your food choices. For instance, a tablespoon of cod liver oil is among the most potent sources available, delivering more than 3 times your daily requirement. Wild-caught salmon in a 100-gram serving can provide about 130% of what you need, while sardines, canned with bones, offer around 110% per 100 grams. Even egg yolks, 2 large eggs give roughly 20% of your daily value, and UV-exposed mushrooms, which can supply around 40% per 100 grams, provided they have been grown with adequate sunlight, contribute meaningfully. For those who relish gourmet dishes, imagine savoring a miso-glazed salmon, around 180 grams, that nearly fulfills 150% of your daily requirement, or indulging in Norwegian pan-seared cod liver with garlic butter, an 80-gram serving that supplies close to 300%. A luxurious option might be a dish featuring scrambled eggs with black truffle and shiitake mushrooms. Combining 2 eggs with 50 grams of mushrooms will cover about 60% of your vitamin D needs. If diet alone isn't sufficient, consider supplements, but be discerning. Not every vitamin D supplement is created equal. Options such as Nordic Naturals Vitamin D3, available in dosages ranging from 1,000 to 5,000 IU per soft gel, are celebrated for their purity and bioavailability. Alternatively, Thorne Research's vitamin D K2 capsules, 5,000 IU each, pair vitamin D with K2, ensuring that calcium is absorbed correctly and not deposited in the arteries. Be cautious, though, certain foods can actually hinder your vitamin D absorption. Processed vegetable oils like soybean and sunflower oil may elevate inflammation levels, impairing the efficient use of vitamin D. Sugary treats and refined carbohydrates contribute to magnesium depletion. Since magnesium is necessary for activating vitamin D, this can compound deficiency issues. Excessive alcohol intake further disrupts liver function, impeding the conversion of vitamin D into its active form. Additionally, high phytate grains such as whole wheat and brown rice may bind minerals, thereby reducing the absorption of vitamin D. Correcting a vitamin D deficiency isn't just about adding a supplement, it's about embracing more sun exposure, consuming nutrient-dense foods, and making lifestyle choices that enhance your body's ability to absorb and utilize this essential vitamin. If you're finding these insights valuable so far, drop a comment below and let me know your thoughts. Now, let's move on to our second essential nutrient, vitamin B12. Vitamin B12, the energy catalyst. Now, let's shift gears and focus on vitamin B12. For those managing diabetes, a deficiency in this vitamin is a common, yet frequently overlooked, issue. One of the primary causes? The very medication that many of you rely on, metformin. While metformin is effective at controlling blood sugar levels, it also hampers your body's ability to absorb vitamin B12 from the foods you consume. Over time, this can lead to a gradual decline in B12 levels without you even realizing it. Moreover, persistently high blood sugar can damage the stomach lining, further reducing the absorption of this crucial vitamin. Aging compounds the problem, as the natural reduction in stomach acid diminishes the body's capability to extract vitamin B12 from food. The subtle onset of vitamin B12 deficiency means that symptoms often creep up so slowly that they are dismissed as normal signs of aging or simply attributed to the complications of diabetes. One of the most noticeable early signals is nerve discomfort, tingling, numbness, or a burning sensation in the extremities are clear indicators that your nerves aren't receiving the B12 they require. But the impact doesn't stop at nerve issues. Fatigue, dizziness, and shortness of breath can all result from B12's critical role in red blood cell formation. Cognitive challenges such as memory lapses, brain fog, and difficulties concentrating may also surface, leading some to worry about the onset of dementia when, in fact, the root cause is simply a vitamin B12 shortage. The systemic effects of B12 deficiency extend to several bodily functions. In men, insufficient B12 can lead to lower sperm quality and reduced testosterone levels, affecting both fertility and libido. Women might experience irregular ovulation and an increased risk of miscarriage. Beyond reproductive health, vitamin B12 is indispensable for nerve maintenance and repair. Without adequate levels, neuropathy can worsen, and nerve damage can become irreversible. The kidneys are not spared either. Low B12 levels can raise homocysteine, a compound that, in excessive amounts, harms kidney function and elevates the risk of chronic kidney disease. Vision, too, may be compromised, as the optic nerve relies on B12 to maintain its health, and in extreme cases, a deficiency can even result in permanent loss of sight. At the cellular level, think of vitamin B12 as the high-quality lubricant that keeps your body's machinery running smoothly. It's central to energy production, DNA synthesis, and the repair of nerves. One of its pivotal roles is converting homocysteine into methionine, which in turn helps to reduce inflammation and protect your arteries from damage. For individuals with diabetes, this conversion is crucial not only for preventing further nerve damage but also for bolstering overall cellular health and improving insulin sensitivity. How can you ensure that you're getting enough vitamin B12? The primary sources are animal-based products, as plant foods do not naturally contain this nutrient. Beef liver stands out as an exceptional source. Just one serving can provide an astronomical amount of B12, far exceeding your daily needs. Shellfish like clams, for example, offer even higher percentages of your requirement per 100 grams. Sardines and salmon are also excellent choices, with a 100-gram portion of sardines delivering about 350% and salmon providing roughly 200% of your daily vitamin B12 needs. Even eggs contribute. Although 2 large eggs only offer about 25% of your daily value, they can still be a valuable part of your diet. For those with a taste for fine dining, there are upscale options available as well. Imagine savoring French foie gras with a drizzle of truffle sauce, a 150-gram serving that supplies around 200% of your daily B12 requirement. Or perhaps Japanese uni, sea urchin, sashimi, with a 100-gram serving offering an astounding 3,000% of your needed B12. For a lavish dinner, lobster thermidor in a 200-gram portion delivers close to 1,500%. However, if these gourmet choices aren't part of your regular menu, high-quality supplements can bridge the gap. For supplement options, products like Garo Formula's Methyl B12 lozenges, delivering 5,000 micrograms per dose and designed to dissolve under your tongue for improved absorption, are highly recommended. Another strong option is Thorne Research's methylcobalamin capsules, which provide 1,000 micrograms per serving and are renowned for their excellent bioavailability and support for nerve repair and energy metabolism. Be mindful, though, certain dietary habits and substances can exacerbate B12 deficiency. Excessive alcohol consumption can damage your stomach lining, further impairing absorption. Processed foods such as white bread and pasta, which are low in nutrients and can promote inflammation, may also negatively impact B12 uptake. Moreover, acid-reducing medications, like proton pump inhibitors, reduce stomach acid levels, making it difficult for your body to break down and absorb vitamin B12 from food. Even diets heavy in refined sugars can create an inflammatory environment that accelerates nutrient depletion. In short, if you're experiencing fatigue, memory lapses, tingling sensations, or just a general sense of being off, it's crucial to have your vitamin B12 levels checked. Reintroducing B12-rich foods into your diet, and supplementing when necessary, can reinvigorate your energy, support nerve health, and even improve your overall quality of life. Folate, vitamin B9, the cellular construction worker. Now, let's delve into folate, or vitamin B9, a nutrient that might not get the attention it deserves in diabetes management. Unlike some vitamins, your body doesn't store folate, meaning you must continuously replenish it through your diet or supplements. Unfortunately, the diabetic condition interferes with folate absorption and metabolism. High blood sugar levels lead to chronic inflammation and oxidative stress, which in turn disrupt the way your body handles folate. Add to that the fact that medications like metformin also block folate absorption, and even if you're eating foods rich in folate, your levels may gradually decline. This is especially problematic because the symptoms of folate deficiency can easily be mistaken for common issues related to diabetes. You might notice persistent fatigue, a feeling of weakness in your muscles, or that your wounds are taking an unusually long time to heal. Brain fog and difficulty concentrating are also common, often misinterpreted as mere signs of aging. However, when folate levels drop too low, the repercussions can escalate, leading to anemia, which means your body isn't producing enough red blood cells. The result? Pale skin, dizziness, and shortness of breath become regular unwelcome companions. The ramifications of insufficient folate extend far beyond just feeling tired. For men, low folate can compromise sperm DNA integrity, diminishing both sperm strength and mobility, which can complicate fertility. For women, folate is essential for maintaining egg quality and hormonal balance. Without it, the risks of miscarriage and other pregnancy-related complications rise significantly. Sexual desire is also affected, as folate is linked to optimal blood flow and the production of nitric oxide, a molecule critical for proper vascular function. Your nervous system also bears the brunt of low folate levels. Adequate folate is vital for producing neurotransmitters, the chemicals that facilitate communication between nerve cells. Without enough folate, neuropathy can intensify, manifesting as numbness, tingling, or even more severe nerve damage. The kidneys, too, can suffer. Folate plays an important role in regulating homocysteine, an amino acid that, if left unchecked, can harm kidney function and lead to chronic disease. Even your eyes are at risk, as folate helps reduce oxidative stress in the retina and maintain proper circulation, protecting your vision over time. Furthermore, the cardiovascular system is not immune. Insufficient folate causes homocysteine levels to rise, which can damage arterial walls, raise blood pressure, and increase the likelihood of heart attacks and strokes. So what exactly does folate do at a cellular level? Picture folate as a skilled construction worker tasked with repairing and maintaining the infrastructure of your body. It is indispensable for DNA repair, cell division, and the production of red blood cells. Folate also plays a significant role in gene regulation and reducing inflammatory responses, factors that are particularly important for individuals battling chronic inflammation associated with diabetes. In addition, folate has been shown to enhance insulin sensitivity by helping stabilize blood sugar levels and ensuring that cells remain robust and resilient. When it comes to naturally increasing your folate intake, food should always be your first port of call. Leafy greens, organ meats, and legumes are among the richest sources available. For example, a 100-gram serving of beef liver can supply approximately 140% of your daily folate requirement, making it one of the most concentrated sources out there. Cooked spinach, in a similar 100-gram serving, offers around 65%, while lentils provide close to 90% per 100 grams. Asparagus, when cooked, contributes about 35% per 100 grams, and don't forget the nutritional boost from a whole medium avocado, which provides roughly 25% of your daily needs. For those who appreciate gourmet dining, there are luxurious options that can also help replenish folate. Imagine a plate of French duck liver pâté, where a 100-gram serving nearly meets 200% of your folate requirements. Or consider a refined Italian dish such as truffle-infused risotto enriched with asparagus and spinach. A 200-gram serving in this style could supply around 120% of your daily needs. Even a sophisticated Japanese meal, like miso-marinated black cod paired with an edamame puree in an 180-gram portion, manages to deliver close to 100% of your folate requirement. If you find it challenging to obtain enough folate from your diet alone, supplements can offer a reliable alternative. However, it's important to choose supplements that provide methylfolate instead of synthetic folic acid, as methylfolate is already in its active form and can be absorbed and utilized more effectively by your body. For instance, Thorne Research 5-MTHF capsules, offering 1,000 micrograms each, are highly absorbable and efficient. Similarly, Pure Encapsulations offers a folate supplement at 800 micrograms per capsule that utilizes methylfolate to maximize benefit. It's also crucial to be aware of certain foods and habits that can deplete your folate reserves or interfere with its absorption. Processed grains such as white rice, white bread, and refined pasta lose most of their folate during manufacturing. Excess alcohol consumption is another culprit, as it impairs folate metabolism, while diets heavy in sugar can accelerate the depletion of this water-soluble vitamin. Additionally, some medications, including certain acid blockers and long-term use of metformin, can hinder folate absorption, meaning that if you're living with diabetes, supplementing this vitamin might be absolutely necessary. Wrapping it up. So, there you have it, the 3 powerhouse vitamins that every person with diabetes should pay attention to: vitamin D, vitamin B12, and folate, vitamin B9. Each one plays an indispensable role in maintaining nerve health, supporting energy production, boosting immune function, and protecting your vital organs from the long-term damage often associated with diabetes. Remember, addressing these deficiencies isn't simply about taking a pill. It involves a comprehensive strategy: getting adequate sun exposure, making informed dietary choices that emphasize natural food sources, and choosing high-quality supplements when necessary. Being proactive about these micronutrients can lead to improved blood sugar management, enhanced energy levels, and overall better health outcomes. If any part of this discussion resonated with you or sparked new insights about your diabetes management plan, please leave a comment below. Your feedback is incredibly valuable. Also, if you enjoyed this video and found these tips useful, make sure to hit that like button and subscribe for more innovative advice on managing diabetes and optimizing your health. Thank you for watching, and here's to taking a holistic, nutrient-focused approach to your diabetes care. Stay empowered, stay informed, and most importantly, stay healthy. See you in the next video.